children should be at the centre of every policy decision. This means, among others, investment in the health, development, nutrition and care of pregnant women, infants and young children. The publication serves as an important resource for all sectors of society to improve the lives of South African children. And researchers say early development interventions should be made even before a child is born.
For me, the critical thing is from conception. So we need to really look after pregnant women, their families, so that they have their support. Birth, so during pregnancy and birth, many developmental disabilities occur. So if we want to prevent children needing special care, we need to give much more attention. And I think it communicates that we care about women and children. So I gave one example. It's just an ordinary example, but in our country, it is policy that women leave a delivery centre, state delivery centre, after 6 hours after birth. If anybody's had a child, they know that the last thing you feel up to doing is getting up, taking your bag, picking up this tiny, precious parcel and walking to a taxi rank, a bus stop, a train station. If we just should, we think that if we get all the systems right, we collaborate, we have interministerial committees, that this will make the actions right. I'm beginning to think, let's get the actions right.
Authors of the Child Gauge 2024 say South Africa has higher infant and maternal mortality rates than it should have for the socio-economic level of the country. And while South Africa is unique in comparable countries in its universal free preschool year, too many children are stunted, a sign of chronic malnutrition. Academics say less than half of 4 to 5-year-olds attending early learning programs are developmentally on track.
It really is a comprehensive approach to early childhood development, encompassing all aspects of child development and health and well-being. And so it's not just about early learning programs or centre-based education, like often we hear people talking about. It's really making sure that pregnant women access antenatal care early, that they get the care and support that they require during their pregnancies, that that we have support for the parents when the baby's born, that they come for their well baby visits, etc., etc. So it's really a much more comprehensive approach than just making sure that we have enough preschools for children and that they get good quality learning in preschools, because that's way too late. We've got to start earlier.
Other key interventions cited include restoring the value of the child support grant to the food poverty line and introducing income support for pregnant women, strengthening support from community and faith-based organizations, and strengthening referral systems and care pathways to ensure that children and families are able to access the services they need.
South Africa made commitments to achieve sustainable development goals, which many of them are child-centered. If you talk about ending poverty, ending hunger, achieving quality education, achieving health for all of that starts with children. So we are reminded through the progress that's reflected in the publication that's launched today that South Africa is actually working towards meeting the commitments that they have made, and to a good extent. Many of the people who spoke this afternoon in this room said that South Africa has come a long way. So South Africa is illustrating, what can be done if you know what needs to be done, if you put the resources towards the interventions that work. But it's also a reminder today that a lot still needs to be done. Our children in South Africa are not where they are supposed to be.
Authors say that at a time when the country is looking for solutions to complex challenges in society, the findings of the Child Gauge is a clear indication that the answers lie in enhancing early childhood development. Vanessa Puna, SABC News, Cape Town.